Ozempic and similar weight loss drugs may do more than help you shed pounds. Recent studies show they could help reduce your risk for dementia and cancer. So I'm joined by Dr. Nita Bijoor. She's a triple board certified physician from Oakview Medical Associates in Greenville. Thank you so much for joining us.
You're welcome.
There's always a new topic to discuss
That's
when
right.
you're talking about these weight loss drugs. So let's start with Ozempic and semaglutide and dementia. What have we found with the recent study?
So the Lancet Journal came out with a study just in July. They did a retrospective cohort analysis. So what that means is they took 100 million patient records and they looked at the ones that had type 2 diabetes, then narrowed it down to the ones on other diabetic medications, and then where semaglutide or GLP1s were added to that. So they compared one called sitagliptin, empagliflozin, and glipizide. So the three traditional diabetic meds where semaglutide was added on. And then they found that there was no increase in incidence of any of these neurological conditions when semaglutide was added, which is good. But they also found a significant reduction in the incidence of cognitive decline, dementia, and possibly some misuse like nicotine disorders. And there was a 50% reduction in those that were on semaglutide versus sitagliptin, which is another anti-diabetic medication.
Yeah,
so that's huge.
Yeah, you can see it there on the name of the drug there that you're referring to.
That's
because
right.
I know that has a long name that a lot of people aren't familiar with.
That's
And
right.
I think that was another important thing to note, that they were comparing people who were on different types of diabetic medication. It wasn't comparing me to somebody on Ozempic.
Right. They were looking at whether semaglutide made a big difference when it was given to patients that were already on other diabetic medications, and to see, they actually studied 22 neurological disorders, which included stroke, insomnia, they included depression, anxiety, OCD, bipolar disorder. So they really compared a lot of them and then found that there was the greatest reduction in cognitive decline and dementia. So that's huge.
And then I think we're kind of getting into the next topic there, which is cancer and semaglutide. So tell me what another study found about that.
So this study came out in the JAMA, also in July of this year, and they looked at 113 million type 2 diabetics, and then they narrowed it down to the ones that were on insulin and the ones that were on metformin. And they studied these patients from 2005 to 2018. So huge study there. So they narrowed it down to about 1.6 million patients. And out of that, they studied when semaglutide was added, was there a reduction, significant statistical reduction in the incidence of cancer? And they found out that compared to insulin, there was a great reduction in cancers, especially the 10 out of 13 obesity-associated cancers, which are pancreatic, liver, gallbladder, colorectal cancer, kidney cancer, endometrial cancer, ovarian cancer, multiple myeloma, meningioma. So the list goes on, but there was no reduction in the cancers for stomach, postmenopausal breast cancer, and thyroid cancer. So
now, why do you think it is? Do you think it's because people are losing weight, so in a sense they're becoming healthier, or is there more to it than that?
So, I believe that the root cause of disease is inflammation. So whatever is triggered, disease states are triggered by inflammation. These medications like the GLP1 receptor agonists, they work by promoting satiety and fullness. So you don't eat as much. Your center in the brain says, I'm full, and that in turn causes weight loss, which then reduces the obesity and reduces inflammation in the body. And we know that majority of disease is linked to inflammation. So it only makes sense that, weight loss actually promotes health. So,
Bottom goal is you want to lose weight and not have so much inflation.
And stay,
that could be a lower risk for a lot of illnesses.
You stay at your optimal weight. That's really important.
All right. Thanks, Dr. Bijoor.